most common cause of ankle arthritis or degeneration of your ankle is a previous injury to the ankle. Eventually, the arthritis sets in, and they end up with bone-on-bone arthritis, and that's something that a lot of us can sort of understand. The cartilage cushion, the brake pads, have worn out, and that causes pain and disability. Patients oftentimes end up with a limitation in their activities. They're unable to work, they're unable to do the activities that they want to do to stay active, and so they come to seeing a physician for that. Now today we have two options really, an ankle replacement and an ankle fusion. The actual procedure itself of an ankle replacement, what we're doing is we make an incision on the front of the ankle. It's vertical in orientation, and then our goal here is to restore the normal anatomy and function of the ankle. We do this using a series of jigs. We're able to make a cut on the distal aspect or the bottom part of the tibia bone, as well as the top part of the talus bone, and then we carefully replace these with metal. This metal is generally made up of a cobalt chrome alloy that then articulates with this piece of plastic that we use to reconstruct essentially the cartilage of the joint or the joint space. This allows nice smooth motion of the tibia bone on the talus. It usually takes about an hour to an hour and a half to actually perform the procedure. After that, you recover in the recovery room for a couple hours, and then you're admitted to the hospital for at least one night. On that first morning or the second morning, you're placed into a cast, you're sent home, and then your recovery really begins. Oftentimes, by about 3 months, patients are walking around pretty normally. I think it's ultimately the patient's choice of whether they choose an ankle replacement or not. It's our job to give them all the risks and benefits and maybe even give them some guidance, but ultimately it's their decision. It's really been in the last 5 years across the country that there's been a trend towards doing more ankle replacements. And it's very exciting to me to be able to bring this surgery to Kalamazoo.